Richard and Lynn, who will be talking about medicine-related falls and fall prevention in older adults from the Peninsula Pharmacists Association.
Okay, thank you, Tina. I am Richard, recently retired pharmacist. And sharing the stage with me today is Lynn, a community pharmacist, board certified in ambulatory care pharmacy, and currently working part-time while being a full-time mom to a toddler. And we are both members of the Peninsula Pharmacists Association, who is supporting this presentation. We're here to talk to you about medicine-related falls and fall prevention in older adults. Have you ever wondered whether any of the medicines that you take might increase your risk for having a fall? Though we will review causes of falls that are not drug-related, today's talk will focus on medicines as a contributor to falls for several reasons. First, medicines are among the most common causes of falls and one of the easiest to change. And medicine-based risks may be missed by busy doctors, especially during this ongoing pandemic with fewer in-person office visits. And as pharmacists, we know a thing or two about medicines and their effects. Now I would like to cite some statistics to show that falls can be serious. 1 out of 5 falls causes a serious injury, such as broken bones or head injuries. Falling once can double your chance of falling again. Each year, at least 250,000 older people are hospitalized for hip fractures, and 3/4 of those are women. Falls can lead to a loss of confidence, a loss of mobility, and the ability to live independently. And even as we see in this next slide, falls can be deadly. This graph is from the CDC, and it shows the death rate from falls in the United States for older adults from 2007 to 2016. And during that time, the fall death rate increased 30%. If this rate continues to rise, by the year 2030, we can expect to see 7 fall deaths occurring every hour. Now, in our presentation, we're going to be discussing a couple of typical examples of seniors who have had 1 or more falls.
He's a pharmacist. Falls.
Here is our first example, and Lynn will present Janice's story.
Many people fall.
Thank you, Richard. So I have patient case number 1. Janice lives alone with her dog Fifi in her home. She has 2 grandkids who visit often.
He said, if you fall once, most likely you may fall again.
Throw rugs and clutter. A week ago, Janice fell in her home. Luckily, her daughter was around. Now Janice is worried she might fall again. So let's think about what may be contributing to her fall and what can be done to decrease her risk. I'm going to turn this over to Richard again to go over general risk factors for fall.
Thank you, Lynn. So risk factors for falling are either preventable or not. Preventable ones include poor foot care for foot problems such as bunions, plantar fasciitis, heel spurs, ingrown toenails, and even peripheral neuropathy, which is a decrease in sensation in the feet that sometimes occurs with diabetes. Household hazards such as throw rugs, extension cords, and clutter. Poor vision, anything really that limits vision, and is correctable. Poor balance, which may be due to conditions such as Parkinson's disease or stroke, and consider the use and abuse of alcohol. Limited mobility, which may be due to one's living situation, as we saw with Janice, or from residing in a nursing home, or from muscle weakness due to a decrease in physical exertion and exercise as we age. And of course, medicines. And with medicine use, taking 5 or more medicines a day is considered a preventable risk factor for falling. Unpreventable ones include female gender, as I have mentioned, and then some medical conditions listed here: arthritis, stroke, diabetes, high blood pressure, Parkinson's disease, heart disease, and dementia. Here are typical side effects of medicines that have been linked to falls. Consider these an overview of side effects of all of the medicine groups combined that we will discuss here today. So effects such as vision changes, drowsiness, confusion and impaired memory or loss of memory, hallucinations, feeling faint, weak, or dizzy, muscle cramps, unsteadiness and impaired balance, low blood pressure on standing from a sitting position, also known as orthostatic or postural hypotension, and nighttime urinary frequency. If you experience any of these, please share them with your pharmacist or doctor. Now, you may wonder why older adults are more prone to medicine side effects. Medicines are acted upon differently in the aging body. Vital organs such as the kidneys and the liver involved in getting rid of drugs from the body become less efficient as we age. And the amount of muscle tissue and body water content decreases while the amount of fat increases, unfortunately, as we age, all of which result in drugs sticking around longer in the body. Then too, seniors tend to have multiple chronic conditions, which can lead to an increase in the number of medicines taken, which in turn can lead to more drug interactions and hence more exposure to drug side effects. Now, Marcus is our second example of a senior who has had multiple falls. Marcus has a history of stroke and high blood pressure, and he takes lots of medicines. For his blood pressure, he takes clonidine, brand name Catapress, amlodipine or Norvasc, and furosemide or Lasix. To help him sleep at night, he takes a drug called Zolpidem, brand named Ambien. He fell 3 times this past week. Recently, his doctor added a couple of new medicines for him to take: oxybutynin, brand name Ditropan, to treat overactive bladder and urinary incontinence associated with his stroke, and amitriptyline, brand named Elavil, an antidepressant being used to treat nerve pain from spinal arthritis in his lower back. I'd like you to be thinking about what you think might be contributing to Marcus's falls, and what do you think he might do to decrease his risk for having more falls? Because we will revisit Marcus a little later in the presentation. Then we'll ask you to come up with your own solutions to these questions. Here are the types of medicines that are most associated with increasing fall risk in seniors. Medicines to treat anxiety, those used as sleep aids. Medicines to treat psychiatric conditions, those used to treat depression. Medicines to treat high blood pressure, those used to treat diabetes, and a group of medicines known as anticholinergics. Now, these are the types of medicines that you, your pharmacist, and doctor should be looking for when reviewing medicines as part of fall prevention. Now, we will first review medicines that affect the brain directly. And the first group in this category are those medicines used to help people sleep or to treat anxiety. Some examples include lorazepam, brand named Ativan, diazepam or Valium, and alprazolam or Xanax, all of which belong to a group of medicines known as benzodiazepines. And this group of medicines has been associated with drowsiness, confusion, hallucinations, memory loss, and they may affect balance. Here are some additional medicines that are used as sleep aids. Some examples include zolpidem, brand named Ambien, Zaloplan or Sonata, and ezopiclone or Lunesta. Now, these so-called Z drugs may affect next day alertness and balance, and they have been associated with sleepwalking. Now Lynn will continue with the presentation.
Thank you, Richard. Wow, that was a lot to take in. So if you guys have any questions along the way, go ahead and input your questions in the chat box or just raise your hands and we're happy to answer them for you. Okay, so moving on. I'm going to go over the antipsychotics first. So this slide shows typical medications to treat psychological disorders. Antipsychotics, formerly known as tranquilizers, can also directly affect the brain, and a lot of them can increase your fall risk. These medications are used to treat schizophrenia, bipolar disorder, and other psychosis. Sometimes they're used to control difficult or harmful behaviors in adults with dementias. Some common examples include risperidone, brand name Risperdal, quetiapine, brand name Seroquel, and olanzapine or Zyprexa. These meds can mainly cause drowsiness, confusion, and orthostatic hypotension. Before moving on to the next slide, I'd like to share with you that 2 of my family members had a fall accident in the past year, both hospitalized, and one of them was my mom after starting a new drug. So as a pharmacist, it's very important for me to help you understand your fall risk due to medications, because I don't want the same thing to happen to you. Antidepressants are another medication class that directly affect your brain and can increase your fall risk. They are used to treat depression, anxiety, and nerve pain. Some common examples include sertraline or Zoloft, escitalopram or Lexapro, fluoxetine, brand name Prozac, and venlafaxine or Effexor. And the other one that some people may take is the amitriptyline or Elavil. These medications often cause confusion, fatigue, blurred vision, insomnia, and you can experience more nighttime trips to the bathroom and daytime drowsiness. And here, just a side note, because of all of these side effects, sometimes patients ask me at the pharmacy, can I take a lower dose? And that's a really good question. Lower doses often have fewer or less side effects, possibly less drug interactions too, and that can lower your fall risk. So you can ask your doctor every now and then to reassess your drug regimen. Is this my minimum effective dose? And it's also important to realize that you can have a moving target dose in your drug regimen. But it's also important that, you know, this is something that you got to work with your doctor and not just experiment on your own. So moving from medications that affect your brain directly to those that do not. Here is a list of medications that treat high blood pressure, the antihypertensives. Some common examples include losartan, amlodipine, clonidine, and water pills, such as furosemide or hydrochlorothiazides, also known as your diuretics. The main problem with most of these high blood pressure medications is postural hypotension. So you have to be extra careful when you're getting up from a lower position. Also be aware that taking diuretics in the evening can increase your urine output and taking extra trips to the bathroom. So to reduce your chances of falling in the dark, it's better to take your diuretics in the morning. So here we have antidiabetic medications that can also increase your fall risk. This group of medicines are used to treat diabetes, and they do this by lowering your blood sugar. Some examples include insulin, glipizide, glimepiride, and glyburide. In terms of side effects, because some of these medications for diabetes can lower your blood sugar excessively, also known as hypoglycemia, they can cause dizziness, shakiness, blurred vision, confusion, and even loss of consciousness. So it's important to monitor your blood sugar on a regular basis. Just as I said here. Our final group of medicines linked to falls are the anticholinergics. This group covers OTCs, or over-the-counter medications, and prescriptions used to treat many different conditions. These drugs include some antihistamines like Benadryl or diphenhydramine, certain antidepressants like amitriptyline, and medications to control overactive bladder like oxybutynin. Side effects include drowsiness, blurred vision, confusion, and memory loss. If two or more anticholinergic medications interact strongly with each other, you can experience even more severe outcomes like delirium and falls. So what should you do, or if or someone you know is taking any of these medications linked to falls? You can review your list of medications with your pharmacist and or doctor. And nowadays, it's much easier to speak with them via the phone or video calls. And your doctor can decide with you, it's best for you to either discontinue the drug when it's appropriate, switch to another drug or formulation that is safer, or to reduce your dose. And because of the concern of withdrawal side effects, it's important to remember that certain drugs need to be tapered slowly under medical supervision, especially for drugs that affect your brain that you've been on for a while. So again, please include your healthcare providers in making decisions about changes to your drug regimen. What else can you do to minimize your fall risk? You can review your medication lists regimen with your doctor or pharmacist on a yearly basis. Just curious here, how do you organize and keep track of your medications at home? Do you share or update them with your doctor or pharmacist? And how do you do them? For example, like my parents, they still keep their pill bottles in a bag and they bring them to the doctor's office. And I don't know if you do this, but some people, they distribute them in pill boxes, or they handwrite them on a list or print them out. They ask the pharmacist at the pharmacy to print a list out for them. Or do you track them on like an online app? Or some pharmacists also have like a patient portal where they can actually print the list out at home. The reason why I asked you this is because a lot of patients ask, like, what are some like easy ways to efficiently keep track of all their medications, especially if, you know, for their caregivers and they have, you know, more than 5-10 prescriptions. There are actually phone apps you can use to manage your medications on your phone or computer, and they're free. And some of them are recommended by the Medicare.gov website. If you like, I can actually type this list of these common apps if you'd like to be tech savvy. Some examples include MediSafe, if you've heard of that before, or CareZone, Care for Today is the other one, Round Health, and the last one is Pill Reminder. So you can actually look for these apps on your phone, and they're free. If you have any questions about them, I'd be happy to go over these later after the presentation. And then another way to minimize your fall risk is to reduce to have regular vision and hearing checkups. That's like, you know, every 1 or 2 years.
Wow.
And just taking it easy around the house. For example, you don't want to get up too quickly from your bed. Take a moment to get oriented before you stand up, as a way to prevent yourself from feeling disoriented and to minimize falling. Not listed here on this slide, I want to also add some helpful interventions to prevent falls. Remember to take your vitamin D supplements with calcium to strengthen your bones. And also to have good sleep habits, because that can reduce your reliance on sleep medications. So good sleep habits include avoiding caffeine before bedtime, having consistent bedtime. And for me, I like to have a warm shower, and I prefer to read the news in the morning versus at night before bed. And if you have seasonal allergies, remember to use the non-sedating antihistamines such as Claritin versus the more sedating one like Benadryl. And lastly, please don't hesitate to use your canes and walkers to prevent falls. My grandpa actually doesn't believe in using these. Actually, he's my great grandpa. He doesn't believe in using these supportive devices, even though he had fell and got hospitalized before in the past. Perhaps it's the stigma behind these devices, I'm not sure, and his high self-confidence. But you know, we remind him that, you know, do it just not only for your safety, but also, you know, for the peace of mind of your family members. But we celebrated his 100th birthday recently, so he must have done something right. Yeah, so don't forget your canes and walkers, guys. All right, so moving on, what else can you do to prevent falls? When you participate in certain exercises to improve your strength, balance, and flexibility, you're not only keeping your body engaged, but also your mind. So when your leg and hip muscles are strong, you're less likely to fall. Does anyone do Tai Chi? because that can help with balance. And if you stretch, that can help with your flexibility. And during this COVID pandemic, you can find many videos online, such as on YouTube, that can teach you certain exercises, specifically for older adults that you can do in your own space. But with a word of caution here, always consult with your primary care provider before starting any exercise program, especially if you have heart problems. Go for Alive is one of the YouTube videos that you can check out if you're interested in participating in these exercises at home. Keeping your home safe is another way to prevent falls. So be thinking about my patient case, or patient case number 1, Janice, and your case. Which of these interventions can she or you use to prevent falls? Adding certain safety features to your bathroom, such as grab bars and rubber top mats. Using non-skid throw rugs. Wear shoes with non-skid soles, so no fluffy slippers. And be sure to have your home well lit. Use night lights in your bedroom, bathroom, hallways, and stairways. And putting away those electrical cords. Avoid climbing stools and step ladders. And being mindful about those sidewalk cracks and uneven surfaces when you're walking around your neighborhood. Okay, so let's go back to our patient case. What can Janice do to make her home safer and prevent future falls? We'll give you a minute or two here to share your suggestions, either in the chat box, or you can just unmute yourself and let us know what you think. Anyone? Are you able to see the chat box, Tina or Richard?
Yeah, I'm looking. I don't see any responses put in the chat box.
Okay. Well, okay, so we came up with using skid-free rugs or carpet tape to secure her rugs from sliding around or tripping her on a rug. And Yolanda says clear clutter. Yes. Reminding her grandkids to put away her toys. Thank you, Yolanda. Let's see. The other is making sure her dog Fifi stays in a fenced area to avoid tripping over her. Oh. Setting up rail by Tina said yes, that rails can help. Yeah, using a cane in the house is a good example of ways you can help yourself from falling. Oh, and I'm sorry. C fell yesterday and have swelling. I'm sorry to hear that. And lastly, our patient can have regular balance and strengthening exercises. Oops, let me go back. So these are just some examples. We'd like for you to look at your own space and think about what you can improve, how you can improve your own situation at home to prevent falls. And Okay, and also Gary added one example is to have to participate in stretching exercises before standing. Yes, to warm up those muscles so they're not stiff before you start to move forward. Thank you, everyone. Okay, and now I will hand this over to Richard to revisit his patient case.
Okay, thank you, Lynn. As for Marcus, do you remember his story? He has a history of stroke and high blood pressure. He takes lots of medicines. Recently, his doctor added a couple of new medicines for him to take. A drug called ditropan with side effects that include confusion, drowsiness, blurred vision, dizziness, and memory loss. And Elavil, a drug with similar side effects of confusion, drowsiness, blurred vision, may cause him problems sleeping, and it may cause him to get up at night to empty his bladder. So what do you think might be contributing to Marcus's falls? And what can he do to decrease his risk for having more falls? So we can use the chat box again to give us what you think are answers to these issues. So Yolanda says, talk to his doctor about falls. That's right on. I would also include pharmacists, but both healthcare professionals can help with that. Slow down and take it easy. Another very good suggestion. And have the doctor check all his medicines, yes, and the pharmacist.
Well, Richard, pharmacists are doctors.
Yes, okay. Okay, well, here's what we came up with then. As for what may be contributing to his falls, it's very likely the two new medicines his doctor recently prescribed, although some of the medicines he has been taking for a while may also be contributing. And here's what we came up with and you also came up with the same suggestion as to what he might do to reduce his risk for having more falls. Most importantly, ask his pharmacist or doctor about his recent falls, who can do a medicine review. And he might also benefit from a regular exercise program. So I'd like you to be looking at your own medicines and ask your pharmacist or doctor to do a medicine review. This is just a note to continue to stay safe out there during this ongoing pandemic, and try not to spend all your money on medicines. Here's a list of the references we used to develop the presentation. And, some good resources here from the San Mateo County Fall Prevention Task Force. And this concludes our presentation. Thank you for your attention. We would appreciate you filling out a brief survey to help us improve the presentation. The link to the survey is listed here at the bottom of the slide, and we will also put it in the chat box for you to click on, and it should take you right to the survey. And we promise not to collect any personal information from you. Also listed here at the bottom of the slide is an email address for our Professional Pharmacists Association. If you can submit any questions that you think of after you leave today, to that email address, and someone from the association should get back to you with answers. Now we'll open the floor up to any questions you might have.
Yeah,
using the
Richard.
chat box.
Yeah, Richard and Lynn, can you tell us a little bit about the Peninsula Pharmacists Association and what else they can offer the older adults community?
Sure, I'm no longer on the board, so I let Lynn speak to this also. But we are engaged with the community, and we do develop other presentations. I think we have one that someone is working on in the association for vaccine hesitancy. Then we are been involved with the San Mateo County Health Department in various ways. I believe we've been asked to provide volunteers to be ambassadors to go out into the communities in San Mateo County to advocate for vaccine use. But Lynn, I'll let you speak more to it since I haven't been very active recently.
As a board member, I used to be on the education committee. So we provide CE programs for healthcare providers, pharmacists, doctors, nurses. And it's also drug-sponsored educational presentations to these providers so they can continue their education and credits. And on the community side, I'm now on the community relations, taking over for Richard. And we reach out to our community members, seniors, students, everybody who is interested in learning more about medications related topics. We used to do more stuff in person before the COVID pandemic. But like we would hold fairs and drug brown bag events. So, you bring your medications and we do a consultation and see if any medications you're taking is necessary or needs to go over with your doctor to see if there's any interactions or questions you have about your medicines. We do consultations with you at these fairs. And, presentations like this, we do more now virtually during the pandemic with you. A lot of things that we do for our community that you wouldn't have time necessarily at the pharmacy when you're there to pick up your medications to talk to your pharmacist. We're there for you outside of those hours. Yeah, we have a website and a Facebook website too, if you want to learn more about the Peninsula Pharmacists Association. You can also go onto the website and subscribe to some of these events. We can email you on a monthly basis about upcoming events for the community.
Great, thank you so much, Lynn.
Mm-hmm. Thank you.
So we have a few questions here in the chat box. First of all, I remember Sue earlier. Sue had asked about gabapentin and its role in causing falls. And yeah, she says she just started gabapentin, can only tolerate one capsule 3 times a day. And how is that relative to other medicines for nerve pain? Well, gabapentin is a good medicine for nerve pain, and it can cause drowsiness. I know that personally, I will share with you that I have been taking gabapentin too for a nerve pain, and I've managed to get it down to just taking it at bedtime, right before I go to bed, and so I'm not then concerned so much with falls. I don't know, Lynn, can you think of any other medicines that are useful for nerve pain?
So it depends on like how severe it is and like how far into your condition. I usually go with topicals first. So before you put anything in your mouth. So some nerve pain topicals or patches that you can try are lidocaine cream or lidocaine patches, because that has less absorption into your bloodstream compared to pills. And with the less absorption into your bloodstream, there's less, metabolism by your liver and other organs. So there's also less side effects. If you've tried patches and creams and topicals already, another topical is capsaicin, which is relatively good for nerve pain versus muscular pain. Then you can try pills or, massages. Before pills, you can do other like, non-pill forms like massages or like other non-medication therapy. Sometimes heat can help. But then in terms of pills, you can try something that is relatively less habit forming first. So for nerve pain, gabapentin, as you mentioned, Richard, is not habit forming compared to the other ones.
Okay, well, that kind of leads into another question from C. Lilleberg, I believe.
Yeah.
What do you recommend to reduce swelling after a fall injury? I'm using arnica cream, tablets, ice, and compression. And
yeah, you mentioned the RICE method, which is good because that acronym basically stands for rest, ice, compression, elevation.
oh, okay. So,
and probably refer to a doctor if necessary.
Yeah. So rest is very important too.
Mm-hmm. Don't overwork that, especially if it's already hurt. But in terms of like other therapies, you can use, there's a lot of other ones like besides gabapentin, there's Neurontin, which is the next step, and something you can definitely talk to your doctor about. There's a lot of other options out there. Great questions. I also included in the chat box the pill reminder apps that I mentioned before, if you're interested, and there's also a link to the survey. Please help us improve our presentation, and we'd like to hear from you.
Thank you so much, Lynn and Richard. Again, thank you. This is very, very informative.
Thank you, Tina.
Take care.
Thanks. Bye.
Thank you. Thank you. Thank you.
Thank you.